Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I am a psychiatrist working in UK. And this morning, I've got Dr. Umer with me, and this is a session on how to get into orthopedic training in UK. Dr. Umer is IMG from Pakistan, who graduated in 2013, and he came to UK around 2 to 3 years ago. And his aim was to get into the orthopedic training, and with his hard work and all the work he's done, he has now secured the ST training in orthopedics. And it is one of the options, which a lot of IMGs ask. They get an impression that it is impossible for an IMG to enter surgical training. A lot of people are interested in orthopedics as well, but they don't get the right messages, right support, or right guidance. So I thought it would be a good experience, or a good thing to do, to actually ask Dr. Umar to share his experience and his advice. So we will discuss about his journey as an IMG. Then he will tell us the recruitment process, and then he will also share some tips on how to improve your chances. So, Dr. Umar, thank you very much for joining me and giving your valuable time.
Hi, thanks for having me.
So, would you like to share your journey initially, as an IMG? That how did you come to this point? If there's anything you like to highlight in
Hmm.
those.
So basically, as you have already mentioned, I graduated in 2013, and I had to find my way. Basically, there wasn't much guidance around. So I went to Singapore for my houseman and junior years to get my core competencies, and then eventually came here at the end of 2019. So I wasn't very sure about the recruitment process. Like different people told me different things. So the best is to go to the recruitment website and see what are the person specifications and what are the self-assessment scoring and what are the requirements basically. So if you start working on those, things become quite simple. One thing about orthopedics is that the more experienced you are, you get negative mark basically. So I was at the point where I had the lowest score, and that's the reason, despite having so many publications, audits, and quality improvement projects, I got negatively marked. And I'm here to tell you how to avoid that basically.
Oh, thank you very much for sharing your experience. So, just to clarify, to apply for orthopedic ST training, you need to have MRCS and also the core surgical competencies signed. You either should have done the core surgical training, or if you
Hmm.
haven't done that, then you need to get the core surgical trainings competencies form signed by your consultant. Is that right?
That's true. So basically, there are two pathways. So I took the more difficult path, basically doing my MRCS and then coming to UK, and then skipping the core surgical training and then applying straight for ST3 basically. And unfortunately, I got rejected last year. So but this year I managed to go in quite easily. So I got my core competencies signed. So which is quite easy to get done in surgical specialties. In medical, yes, it's a bit difficult, but orthopedics and surgical, it's quite easy. Like you work with a supervisor, and if they're happy with your work, and you show them most of the stuff you can do, they will probably sign for you within 3 months.
So once you came to UK, you started a job in orthopedic itself. So that give you some advantage of developing your CV and improving yourself?
Yes, so when I joined in UK, I was in a bit of dilemma to whether to go down F2 route or just go for a registrar route, because I had the experience in which I could go either way. And some of my friends, they actually went down the foundation year 2 routes and then core surgical training route, and then eventually ST3. But soon after I joined, COVID came, and people were stuck in whatever position they were. And just before COVID, my hospital had offered me a registrar job already. So my plan was to start the registrar job for a few months and then work on my self-assessment things, because somebody had told me that things are in Singapore are quite not recognized here. But eventually, I found out that wasn't true, and I went to the self-assessment website and read the person specifications, and I realized that I meet a lot of them.
Mm.
So I started working on them there on. The other problem was my experience basically. So I would advise the juniors, if you are less experienced, let's say your graduation is within the last 4 years or so, and you have not have much orthopedic experience, I would say go down the foundation year 2 route and then do the core surgical training and then apply for the ST3. Yes, you need MRCS, and there are a few other requirements. Because of COVID, they keep changing. Like last time, ATLS was the main requirement. You couldn't apply without ATLS, but these requirements keep changing, and that's why you have to go to that place to see the person specifications and self-assessment, and to see what are they looking for next year.
So if we come to the recruitment part, I think you already started talking about that, but that is the important bit the IMGs like to know, that what is the recruitment process like in orthopedic? If somebody wants to become an orthopedic surgeon, what is the what is the process like? Where does it start?
Okay, so the process start right after the graduation, basically. So if you can, I mean, if you are an undergraduate, I would recommend that as soon as you finish your med school, you should find a way to come to UK, either do a PLAB or like, the second route I'll discuss in a bit. Or if you're staying back in your home country, again, go to their website and look at the person specification and start developing your portfolio right from there, because orthopedics is quite tough to get into. It's not an easy specialty to get into, so you have to work right from the day one. So start working on that and build up from there. So if you're going down the PLAB route, do it soon. Find a foundation year 2 job. Apply for core surgical training. Now, some of my friends did core surgical training here, and core surgical training is quite difficult to get into. A lot of IMGs, despite having good CVs, they can't get into core surgical training. And this, I mean, they get disheartened and they change their specialties. So if you don't get into core surgical training, that's not like end of everything. So you can do a non-training SHO job or ST jobs and keep building your CV and eventually work for ST3. That should be the eventual goal, basically. So ideally, if you are less experienced, go down the F2 route, core surgical training route, and then apply for ST3. If you can't get into these things somehow, keep working, because you don't lose much. And I'm an example, basically. I didn't go down the F2 route. I just I didn't have a chance to do that, and I just built up my CV, and here am I.
Okay, and the application process you were saying about the personal specification, I think that is very important message, that as it changes every year, they might bring something else next year. That rules are actually constantly changing. So we are recording this in June of 2022, and what you're talking about may be valid for August 2022 recruitment round, but next year it might change. So in terms of actual recruitment, so you obviously you put in your application, and then what happens after that? You get longlisted first.
Okay, yeah. So, I mean, we apply through Oriel. I think they have made Oriel the standard. Basically, everybody applies through Oriel. So you put in your application through Oriel, and if you are eligible, they will let you know. And if you are not eligible, you can't like proceed after a certain point. So let's say you don't have your core competencies, you can't proceed with the application. So you go through the Oriel, submit your application, you get longlisted, then you get shortlisted for the interview calls. And then in orthopedics, the general policy used to be like they used to invite everybody for the interview, and they used to have some cutoff points where they said, okay, these guys are eligible and these are not. So, but this has changed in the recent 2-3 years. So let's say like 500 people are eligible to do orthopedics, but they only got like 120 seats, so they will pick up top 120. So like this year, they had 123 seats for orthopedics, which eventually increased to 157 actually. And yeah, so the top 157 will be taken, or people like who dropped orthopedics for some reason. The guy who's in the lower rank, they will be like given the position.
And
So
there's
and then
no
eventually you accept the offer, and then start paperwork and everything.
and there's no second round. Just to clarify, there's some specialties have second, third rounds as well, but for orthopedic it would be just one round, which is
Yeah,
the.
so I don't have very good understanding of these round 1 and round 2. I think most ST3 jobs are round 2 already,
Hmm.
but I'm not sure how these round systems work. But orthopedic has got one round only. It's not, there is no other round. We can call it round 2 or round 3. So there is just one round. And if let's say I got in and I didn't choose orthopedics and I chose a different specialty, my seat would be given to the one who's after me,
Okay,
basically.
after me. So this starts in the advert will come out around in October time. Normally, the national recruitment.
Their starting times are quite variable, and that's quite interesting actually. So you get your results this year we got the results at the end of April, basically. So this also changes by a few weeks every year, but it's more or less quite constant. Interviews happen in early April or end of March, and then you get your scores by end of April, like. And after that, there are a few months of like a few weeks of actually applying for upgrades and downgrades and all this. So the first rotation starts in August. So it depends on the deanery, basically. So it's divided into different deaneries. Yorkshire and Humber are the one who lead all the selection process. So some deaneries, they start their training from 3rd of August, some start from September, and some from October, and some even start in the February next year. But all the outcomes, even people who are going to start in February next year, they have their outcomes by now. And it's
Okay.
more of a personal choice rather than like, there are few options on there. If you rank February 2023 as your starting point, you will start there. You won't have to apply for it again.
And what was the interview process was when you when you were long listed? I mean, by long listing, I just like clarify from the MGs. Long listing mean that you meet the minimum criteria. So they will check your core competencies form. They will check your that you have done MRCs and all that. So once they're satisfied that you are meeting the minimum criteria, then they will call you. That's what we call the long listing. And then shortlisting, they will look at other criteria as well. So when you were applied, when you actually went for the interview, what was the interview experience like? How many stations were there, and was it online or was it face to face?
Okay, so that's probably that's probably the most important question of this whole video basically. So interview, once you are longlisted and you're given the interview dates, that's actually the real deal, because in orthopedics, uh, most of the selection is based on the interview. People might have very good portfolio score and they might not do well in interview, and similarly people might have very, very poor portfolio score, just good enough to get in the interview, and they don't. So interview basically has 3 stations. So one is a portfolio station, which is quite subjective. They will usually open with like, tell me about yourself, and basically you have to sell yourself there in a way that they like it. And then they will just pick up one of the things from your CV, and they will start discussing about it. So for example, for my CV, they started talking about my publications on soft tissue sarcoma. So they asked me a lot of questions about that, and in the end they asked one very important thing. They said, like, do you know about sarcoma referral system in UK? And just few days before my interview, one of my seniors had told me, just look at the system. How does this thing work in UK? And they were very, very impressed that I know the system, how it works in UK. So they want to know basically how do you fit into their system, and can they work with you? Basically, they're trying to find out. And then they will ask you some general questions like, what is GERFT, and what's the difference between leadership and management? What is audit? Some basic questions like that. But recently, in last 2-3 years, I have noted that they are not asking these general knowledge questions. They are asking more about your CV and how you might fit in their system. The second station is a clinical station. That can be very difficult, or that can be quite easy, but that's purely based on your knowledge. So if you study hard, do your question banks, have a meeting with your friends and all, find a buddy for interview preparation, I think you can do very well in the interview in that part, because clinical question, that's under your control basically. And the questions are basically on orthopedic scenarios like road traffic accident, somebody having certain sort of fractures, their basic management. They don't go into too much details. One thing we have to understand that this interview is based on people who are finishing their core surgical training and are trying to enter high surgical training. So we need to act like a core surgical training who's just a day one registrar. So could you manage this injury if you were a day one registrar basically? And they might ask you some classifications and some basic questions like how to consent a patient for hip replacement. And in that, they are not looking for your knowledge, to be honest. They're looking for how systematic you are and what's your approach basically. How do you approach an injured patient? And they could discuss other orthopedic sick patients in wards. So that's all about clinical. So clinical is again 2 stations crammed into 5 minutes each basically. Then the last one and the most tricky station is the prioritization station. And this actually, the prioritization station, it comes even when the consultants, registrars applying for consultant jobs, and it just gets like different difficulty levels. So they give you like list of 6 or 7 patients, and it's the scenario is usually this is 8 a.m. and you are sitting in your trauma meeting and you are asked to prioritize this patient for operation or transfers or whatever. So there are 5 or 6 patients and you've got 10 minutes and you have to give a good reasoning basically. And in that, they are basically looking at few things, whether you can work under pressure, whether you can do right allocations, you don't miss the injured and critically ill patients. So that station can be very, very tricky. And so far, from my last year's and this year's experience, this is where most people struggle basically, because as I said, like everybody who's applying for orthopedics, more or less, they prepare very, very well. And it's just a matter of, we've got 10 minutes to discuss everything. So that's where most people suffer basically. So the whole interview is 30 minutes. So these three stations, portfolio, clinical, and prioritization, 10 minutes each, and that's it basically.
So this is, yeah, this for based on the scores of that, you will be given the merit for basically to
Yeah, so
see where
that's
you can
also
go.
a bit tricky. So you get a score, you get an interview score. This year it was marked out of 150. Actually, in fact, every year it's marked out of 150. And then you have got an additional 32 marks. These are your portfolio marks. So if you have a good amount of orthopedic experience, and a good orthopedic experience is 24 months, 24 to 30 months, you will get maximum marks.
Mm.
And if you've got more experience than that, you start losing marks slowly.
Mm.
And by the time you reach 60 months or so, let me just see. Yeah, so this year it was 77 months or more, you get 0 marks. Sorry, 60 months or more, you get 1 mark only.
Okay.
Yeah.
And so this is the important thing about developing your portfolio. So I think that you mentioned, reason I was asking you that,
Hmm.
having that portfolio and marking based on that portfolio is also contributing to your final score.
Yes, yes. So those 32 marks are basically purely your portfolio marks. So whatever you score in that thing. So if you are more experienced, like in my situation, I can't get more than certain marks. So to be honest, I mean, my portfolio score was quite low. Out of 32, I only had 14.2 or 14.5 marks. And that was just enough to get an interview call, because some of my colleagues who had 13.5 marks, they didn't get interview call.
Mm.
And this is despite having 11 PubMed Index publications, 10 audits in last 2 years, and 2 quality improvement projects, and plenty of international conferences. It's just that my experience, number of whatever I have done, it gets divided by the number of years of experience I have. And that's very, very important, especially for the junior trainees, because they have time, and they can allocate their time and do other specialties while saving their orthopedic experience and saving their points. I will shortly share a screen,
Yeah, that's fine.
self-assessment scoring screen basically, which will show you exactly like how much experience gets you how much marks and all this.
And this self assessment is done at the point of when you apply for that, isn't it? When you're applying for.
Yes. So since COVID times, they let you do your own self-assessment basically. So you look at your portfolio, you give yourself some marks, and you submit your evidence on a portal. Okay. So they will review your evidence, and then they will either increase your score slightly or decrease it if they are not happy with one of the, And yeah, I mean, very important thing. If you submit fake stuff, they can actually go to GMC and you get blacklisted. So yeah, so try not to do that. So yeah, so you do that, and then you get those marks out of 32. So normally in their presentation, they say everybody who applies should get an interview, but because of logistics and all this, they don't call everybody for interview nowadays. So they set up a cutoff mark, and then below that mark, even if you are very good, you won't get an interview call basically.
So you can share your screen, and I think it'll be helpful for the people to see.
So can you see my screen?
Yeah, you can see it now.
Okay, so this is the self-assessment scoring system, as you can see here, and this is for the 2022, basically the one that I used to apply. And this is nothing special. This is on Yorkshire and Humber website basically, and this is just a PDF file I downloaded. So the question 1 is basically, so by the end of July 2022, or by the completion of core training, how many months will you have spent total in any job in medicine post foundation program? So there is a trick here. So let's say if you have got 5 years of experience overseas, and you do your foundation year 2 in UK after 5 years, so your experience will only be counted from foundation year 2, and that's a very good thing basically. This is for people who have got 10 years of orthopedic experience, and they are starting to basically they want to restart basically. So if they can somehow get into F2, so I don't know what are the requirements for F2 year nowadays, but if they can get into F2, they can actually restart this, and they can start from 0, to be honest. So this is very important, because this N number, as the N number increases, you get negative marking basically. If you have got, let's say, 5 publication and more than 77 months experience, you only get 1 mark. So you understand what I'm trying to say, right? Yeah. So next question is question number 2. So that's another very, very important question. By the end of July 2022, or by completion of core training, how many months will you have spent in trauma and orthopedics post foundation job again? That's the wording basically. So again, this is where you get maximum marks. So they increased this this year because of COVID, people couldn't do much of orthopedics. It used to be, I think, 30 months last time. So I usually recommend people to have orthopedic experience of no more than 30 months if they are trying to apply for ST3 in UK. And as you go higher up, you get less and less marks. So just imagine if you got 40 months experience, you get 8 marks here. And if you got 60 or more months, you just get 1 mark. Last time it used to be 0 last year. And then there is question number 3. That's another very important question, but this can be achieved rather easily. If you are doing core training, you will get this automatically. If you are not, you'll have to work a little bit, change your job, and So there are a few specialties like plastic surgery, vascular, ENT, and all this written here. So if you have done 2 of these specialties, more than 4 months, or at least 4 months, you get maximum marks here. And most of the applicants, they get full marks here. So this one, this is the bare minimum. So you should have these. The next one is, this is a certain surgical procedure. Basically, it's a DHS or IM nail. So if you have done 12 or more, you get full marks in this question. So this one, an average applicant is expected to have full marks in this one. So question 5 to 7 are quite tricky, basically.
How do you evidence that DHS nail? You have to show them a logbook or evidence signed by a consultant.
You would normally log them in your logbook. So there is an e-logbook. If people who are doing orthopedics or doing surgical jobs, they know about the e-logbook. So they must log their cases there and ask one of their consultant to either sign it or can digitally, get it verified, basically. So if you have done part of surgery, you can actually, score full marks in this one. So 12 or more, that's it. So going from question 5 to 7, that's the bit tricky part here. So question 5 is about your publication. So 5 has got 2 parts. 5A is about your first author publications, and you get 2 per paper. I mean, one could ask, I've got 10 first author publication, I should be getting 20 marks. So they don't work like that. Basically, they would just accept certain amount of publications. And the second thing is they've got a formula again on the website. So they put everything in that formula, and that formula is quite easy actually. So 2 per paper, first author, and then 1 per paper if you are any other, like second or any other author. So there is another question here. Some people are quite confused actually. Is second author considered a first author as well or not? So second author is not a first author. Okay, unless in the paper it's clearly mentioned that this paper is written by 2 joint first authors. The second author will not count as first author. So again, and then question number 6 is about number of international presentation. So the good thing about this question is people who are coming from overseas and they have attended their regional presentations and they've got a certificate for that. This is considered international as per UK standard because it happened outside UK. So that's a strange thing, but you get points for that. So anybody who has presented papers in Pakistan or India or anywhere else, they will get points for this. And then the last one is audits. Where is it? Yeah, audits or quality improvement projects. So if you have done a loop audit, you get 2 points. And if you have done just one cycle of audit, you get 1 point. So people who have maximum experience, they need to have 10 audits to get full marks. So just imagine if you have got 5 years experience, you get 0.2 marks per audit, and 0.2 into 5 is like 1. So that's the thing.
This and the audit has to be in orthopedic, or they could be anything.
Oh, it can be anything,
Yeah.
People have been asking me, it can be a very simple thing such as audit on hand washing. Like, you can do an audit on hand washing in just 1 day, basically. So it can be any audit approved by the department and has been presented properly, and you've got a certificate for that. This question number 8, most of us don't have it. And generally the seniors recommend, if you are into masters and PhDs, then go for this. Otherwise, it's not worth going for these 2 points and spending 2 or 3 years just getting these 1 or 2 points, because masters and PhDs do take time and a lot of dedication actually.
Yeah, so, I think part-time masters can take up to 3 years or a year, or as you said, quite expensive, very expensive as well to do.
It's very expensive, and I myself am doing a master's in education, and I have not managed to complete it. I've got 5 years to do it. So it's very expensive, and yes, it is time consuming, and sometimes you don't have the motivation to do it. So I would recommend that if you are not into masters and PhDs, try to skip these, and it won't hurt you that much. It's just losing 2 points here. And then this one is very important. Every applicant should have it. Involvement in leadership or management. So if you've got some national thing, basically national leadership thing, you get maximum marks. If you've got a minor one like rota management and all, you get like 1 mark. So again, most people should be able to score full marks in this.
This is becoming part of the different regional committees like British Medical Association, BMA, or your own surgical
Exactly.
organization.
Yeah. So in this one, basically, they are looking at what you have done, basically.
Mm.
So let's say you have organized a course,
Mm.
which has become very famous nationally, and or you have done a special thing. Basically, it doesn't have to be a course. It can be some voluntary activity and all, which is a very good and had an impact. You can get full marks on this, basically. And then the next one, I have a formal qualification. Most people try to get it because it just takes you 1 year. Again, it can be quite expensive. And I'm halfway through that. I've got 40 credits already. I've got 20 more to go. But again, I didn't get marks for this. So this gets you 1 mark, and it takes you at least 1 year to do it. 10B is one of those questions where everybody should score marks, because in every hospital we have got opportunity to do formal teachings in the department or to medical students or foundation doctors. So I think that's about it, about the self-assessment.
Yeah, I think thank you for sharing that. I think as you mentioned earlier, that a lot of these things you can start in your home countries as well. When you are even as a medical student level as well, you can start to develop some understanding of research,
Yes.
publications, some basic understanding of audit. I think that those goes for every specialty, not just orthopedic. I think that's relevant for other specialties as well when you're applying for it. And the other thing you mentioned, which is very important, I think a lot of people get worried about having additional qualifications, and when they see that as a part of criteria, they get really stressed that I don't have a PhD, I don't have a master. So even the British graduates, quite a lot of them don't have these things, but you can see when an audit can actually give you similar marks to a PhD, then it's
Exactly.
better to focus yourself on a good quality improvement project which you can do for free, and
Exactly.
as has a poster out of it as well, has an international presentation out of it as well, and a lot of other things that can happen on side of that, in comparison to doing a PhD, which might be a 5-year, 6-year course and might be costing you like 20,000-30,000 pounds. I think it's
Exactly.
not wise to actually. You have to be careful about when you're thinking about these things.
Exactly. And the interesting thing is, if you are interested in doing a PhD or master's, a lot of deaneries, once you get a training number,
Mm.
they actually support you to do that. They give you time off from training, and you can do it at that time. Or if you are really dedicated, you want to do some research and find out something, you can actually go for that. But again, if you're applying for training, that's only going to get you 2 marks, and doesn't we don't know like how much time it's going to take to get you there.
Mm.
And
In terms of orthopedic training, so it is 5 years, as I understand, the ST training.
it's 6 years.
6 years,
Quite
okay.
long, yeah.
And then you have different options about sub-specialization within orthopedic as well. Some
Yeah,
special
so normally what happens is you start your ST3. So some deaneries, they start orthoplasty heavy, some are trauma heavy for the first year trainees, which is ST3. And then you go on to do like different subspecialties like upper limb, shoulder and elbow, and like things like that, hand and hips and knees and foot and ankles and all, and spines, and even tumors. Once you are like within 2 years of specialization, you sit your FRCS exam, which is again another a very difficult exam. Once you clear that, you do one specialty of your choice during your training, and then once you have finished your training, you get awarded a CCT, and after that you go for fellowship. Fellowship can be, people do different fellowships, can be anything between 6 months to 2 years or even longer, so depending on your interest and all. And after that you apply for a consultant job.
And I understand there's a lot of opportunities for British trained orthopedic surgeons abroad as well, because people are asked that as well, that can I go and work in the Middle East, or can I go back to my home country, or
Yes. So that's very important. So if you have got a CCT, so I actually wrote one line in my post there the other day, which people actually got a bit confused about. So CCT, if you have got CCT, you will get priority. Unfortunately, that's how things are nowadays in Middle East, especially. Like a lot of people, especially from Pakistan and India, they want to go to Middle East because it's somewhere in the middle, basically. So CCT gets actually like more. They were accepting the Caesar trained people and all, but now they're completely, they're not accepting recently. So even in UK, if you don't have a trauma fellowship, it gets very difficult to find a consultant job if you have done a Caesar pathway. But this is not to discourage people. If you can't go through CCT route, you have to do something. You can continue. I myself was thinking of doing a Caesar pathway, so it's not like end of the world basically.
And the other thing about orthopedic, I think a lot of people would ask about the private scope of private practice as well. I think there are still good opportunities that
Very good opportunity.
consultants
If you want to
in.
stay in UK, yes, plenty of opportunities. And every city, like I'm in a small Chester city, we've got private hospital there, and a lot of consultants from my practice to go there and they work there.
Have you got any general advice for IMGs who are actually looking at UK? Because they can get, as you mentioned earlier, they can get mixed messages. They don't get right support. Have you got any general advice about them for them? That
okay, so first of all, first advice. So how experienced they are. So I'll start from there actually. If you are too experienced, or if you are in a place like me, basically, so try to skip your core surgical trainings and do your MRCS, get your core competencies signed, and apply for ST3. Build up your portfolio rather than wasting time on applying for F2 or CSTs and all this. If you are junior and you don't have much experience, go for the foundation route, because once you get like in the streamlined route, it's easier for core surgical trainees to get into ST3 basically. That's a summary. If you're a medical student, start building up your CV, because you are the best spot actually. And yeah, that's it. So there are three types of people: medical students, junior people with less experience, and people who have like not so significant experience, but they lose all the marks because of the experience. So these three are the options. And the last category is basically lot of experience but don't have much research work or audits and all. So their portfolio score will be quite low, and unfortunately low enough to not get interview call. So if they think like that, or if they don't get called for interview, it's better to embark upon the Caesar journey or have a plan B basically. One very important advice would be to have a plan B basically. If you don't get in after a few years, you think about other specialties.
Yeah, I think with the Caesar, I would like to mention again here, so people get confused about the route as well. So basically, if you don't enter the ST training, couldn't enter the ST training, you can still work in UK as a non-training grade. So you can start as a junior grade, then you can become a middle grade, which is again will be non-training, which we call a specialty doctor. A lot of people try to do Caesar from that, so they try and do FRCS from that position, and then apply for Caesar. And that is a route. It is hard again, like training, but it is people have done that in the past. But the main issue is that if you really want to work as an orthopedic surgeon, then you might not become a consultant, but you can still continue working at a middle grade, because that is a message people sometimes get, that if I don't pass my exam, I will not be allowed to practice here, and they get a bit anxious about that.
No, I don't have an exam yet. I don't have FRCS yet, and I'm working as a middle grade. And I would, if I wanted to, I would continue to work for as long as I wanted. Because this year I was going to get my job permanent basically, because I have been in UK for about, it's not 3 years yet, but in a few months it will 3 years and at just one place. So they were going to make it permanent. So, and I could work for as long as I wanted to.
Okay. So thank you very much for your guidance and your advice. I think it will be very useful for people looking at orthopedics, and you are a very inspiring character in that sense, because you have done what a lot of people are already thinking or aspiring to do. I think they can learn from you as well from this. So thank you for sharing your experience.
Well, thank you very much for having me. And I would just say in the end, like just go to person specifications and self-assessment and build up your CV from there, and see where you are from the time of your graduation, how much experience you have. This will decide how much work you need to do and all.
Thank you very much.
Okay, you're most welcome. Thank you.